Welcome, students! Diabetes mellitus is defined as a group of metabolic disorders in which there are high blood sugar levels present over a long period of time. But what does this actually mean and how does it manifest? To answer this question, we first need to learn about something called homeostasis. Derived from the Greek word homoios, meaning the same or similar, and stasis, meaning to slow down or to stop. Homeostasis is the process in which equilibrium is maintained in your body. For example, your body's core temperature should always be around 37 degrees Celsius. If it is a hot summer's day, your core temperature will increase due to the heat. However, to prevent this, your body will sweat to cool you down. This is a form of homeostasis, as your body tries to maintain the same core temperature at all times as best it can, to counteract against the changes in the environment. Now that you understand the concept of homeostasis, I will now explain the role of the pancreas in the regulation of blood sugar levels. So what exactly is the pancreas? The pancreas is an organ inside the body that contains these structures called islets of Langerhans. Discovered by the German pathological anatomist Paul Langerhans, you can think of these islets as little islands or clusters of cells within the pancreas which produce specific hormones. Within these islets, there exist alpha cells and beta cells. Alpha cells produce the hormone called glucagon, derived from the Greek words glucose, meaning sweet, and agon, meaning leading or bringing. Glucagon increases the blood sugar levels by causing the liver to convert its glycogen stores into glucose. Glycogen is one of the ways that animals store the carbohydrates in the body. It is effectively a branching chain of glucose molecules stuck together. As well as alpha cells that produce glucagon, there exist beta cells that produce the hormone called insulin. Derived from the Latin word insula, meaning island, and in, meaning inside. Insulin decreases blood sugar levels by initiating the process that moves glucose out of your blood and into your body's cells. As you can see, the opposing actions of glucagon and insulin help to maintain a steady blood sugar level, therefore maintaining homeostasis. If, for example, your blood sugar levels increase after, say, eating a meal, insulin will be secreted from the beta cells to reduce your blood sugar levels back to the normal. Conversely, if your blood sugars drop too low due to the lack of food or after some vigorous exercise, then glucagon will be secreted from alpha cells to raise blood sugar levels back up again. When this process is working properly, then all is fine. However, diabetes occurs when your body can no longer maintain blood sugar homeostasis. But how exactly does a failure of blood sugar homeostasis occur? The different pathways to this failure are diagnostic of the two main types of diabetes, type 1 and type 2. In type 1 diabetes, the symptoms are usually present from birth and is characterized by the loss of beta cells in the pancreas. This leads to an insufficient production of insulin. Without insulin, you cannot lower your blood sugars and are therefore not in homeostasis. People with type 1 diabetes are prone to having high blood sugars and need to take insulin injections for the rest of their lives. But what exactly causes the loss of beta cells in people with type 1 diabetes? It is thought that in most cases, an autoimmune attack on the insulin-producing beta cells is the cause. Another possible cause could be that genetic defects lead to the formation of inadequate beta cells. However, in some cases, the cause is just not known. How does type 2 diabetes differ from type 1? Type 2 diabetes is caused by the development of insulin resistance. An insulin-resistant cell does not respond well when insulin is present, and therefore will not take in glucose from the blood. This then means that blood sugars are not lowered, and therefore you are no longer in homeostasis. Well, how does insulin resistance develop? Insulin resistance is caused by the constant stimulation of beta cells to produce insulin. This occurs when your blood sugars are always being increased by the constant eating of sugars and carbohydrates. Your beta cells then have to constantly secrete insulin to move glucose into your cells to lower your blood sugars. If this continues over a long period of time, your cells start to become insulin resistant by downregulating the transport of glucose into the cell. This means that more and more insulin is needed to overcome your cell's tolerance to insulin and to lower your blood sugars. If this process keeps on continuing, your body will eventually reach a point where it cannot produce enough insulin to overcome the insulin resistance of your cells. At this stage, your blood sugars will always remain high as insulin is no longer effective at lowering it. It is at this point where you'll be said to have either prediabetes or type 2 diabetes. So, in summary, diabetes is the failure of blood sugar homeostasis. Type 1 diabetes is caused by the loss of insulin-producing beta cells. This leads to the body not having enough insulin. In contrast, type 2 diabetes is caused by the development of insulin resistance in the body. This ends up with the body's cells not being able to respond to insulin. Both types of diabetes result in high blood sugar levels. Thank you for listening, and I hope you learned something new from this video. Like and subscribe for more educational content, and leave a comment to give me some feedback.